what the world looks like for about 80% of people with albinism. Poor sight is something they have to grapple with from birth, and as a result, they need special lenses and visual aids to get a clearer perspective on life. This is where Dr. Choksey comes in. Sharon Wanjiku is sitting in for a routine eye checkup. This large white contraption is a fundus camera that allows Dr. Prabha Choksey to examine the interior surface of Sharon's eye. A crucial exercise for little Sharon, who has albinism, a defect of melanin production that results in little or no color or pigment in the skin, hair, and eyes.
Many of these children do not have good sight, so they are visually challenged. They are very much visually challenged, and as far as I see it, an ophthalmologist actually is the person, or the eye specialist is the person who plays a major role in the life of an albino person, because they are the ones who can actually determine what sort of a visual status he has and how much can he be helped.
And help is exactly what Dr. Choksey has provided for well over 600 albino patients by offering free eye exams and photochromatic glasses for the last 6 years, courtesy of the Dr. Choksey Albinism Foundation.
My own observation is, out of these 600 people or more that I have seen, more than 590 probably, I'm the first ophthalmologist who is actually seeing to see what exactly is the status of their vision, how best they can perform, what are the glasses prescription that should wear, and some of them are extremely short-sighted.
As a result, many children with albinism are often enrolled in blind schools and other special institutions because parents and teachers alike label them as a lost cause in the Department of Sight, oblivious to the fact that a pair of glasses is all that is needed. A predicament Grace Nzomo found herself in when she joined Moy Girls through the school's integrated program.
I was put in the bracket of blindness at that time, and I had to learn Braille on my own, and then I used it for KCSE. I feel like a part of your life was really messed up in high school, because they took you back. You already grew up knowing that you can see well with glasses, but when you go to high school, you're told you do Braille because you're blind. So you are moving 10 steps forward, then you are moved 100 steps back.
Today, however, Grace is a first-year student at USIU, majoring in psychology, with a dream of setting up her own practice to deal with developmental issues in children. Dr. Choksey has dealt with many children and young adults like Grace and has been championing for better treatment of students with albinism in schools.
At the moment, we are paying fees for more than 40 albino children to go to the school. Most of my children actually stand first in the class, and they are doing extremely well in the schools.
Reading aids such as this one Vince is reading from goes a long way in accommodating children with poor eyesight to learn in the classroom.
Of his bent elbow with the cup, the palm of his other hand.
Vince is a beneficiary of Dr. Choksey's foundation that has taken the load off his grandmother, who raises him on her own after his mother left due to his condition. It certainly is a labor of love for Dr. Choksey, who has been an ophthalmologist for the last 25 years, having garnered several awards for her work in the field. Her greatest hope is that society is not just tolerant of people with albinism, but appreciative of their unique talents. Nicholas Mburu, who has been coming to see Dr. Choksey for years, is a perfect example of that, as he strums his vocal cords to create a melody he hopes will catapult him to stardom in the gospel music industry. For Women in Power, I'm Victoria Rubadiri.